So most of us are aware about MRI. It doesn't need an introduction. And it definitely plays an extensive role in oncology because we had two oncologists speaking before me. And unless you detect the malignancy accurately, you can't treat it that well. And what gives MRI the power to deliver? Well, definitely it's multiplanar imaging. That is, you can image in different planes with MRI with the patient in the same position. You have multi-echo imaging. That is, you have different sequences. And these sequences enable you to do the diagnosis very accurately. High resolution, most definitely. Contrast MRI, all of us are aware that whenever the need arises, we do contrast MRI. But now we have further more developments in contrast MRI as well. And definitely as technology moves ahead, we have higher applications which enable better imaging. Going on straight to the clinical applications. Now this patient has a gross abnormality in the left high frontal region on the flare axial. And whenever we see this kind of edema, a contrast is definitely required to be given. On the contrast images, there is inhomogeneous peripheral enhancement, and there is still no clarity whether this is an abscess or a neoplasm. Therefore, we do a mass spectroscopy and we get a graphical representation like this, where we have graphs of different metabolites, normal as well as abnormal. And the large red arrow here points to a metabolite called choline, which is a metabolite for malignancy, and it represents cell membrane turnover. So this patient has a large choline peak suggesting a neoplasm. Another gross abnormality in the right occipital region, where even on the plain MRI, it shows a very aggressive nature. So also the contrast image shows that it has a very strong but heterogeneous enhancement, and it is likely to be a neoplasm. But definitely we'd like to confirm that, and we do a mass spectroscopy again with a high choline peak, and we rely more on the choline to NAA ratio to say whether a lesion is malignant or not. This is a very good example to tell you what exactly is the utility of different sequences. If you can, please focus on the T1 axial image of both orbits. You can see that there is an abnormality in the globe of the left orbit, and there is a bright signal which could either be fat or hemorrhage. So we suppress the signal from the fat, which is the T1 axial fat sat image, and you can see that the signal is still bright, so it's not fat, but it's hemorrhage. And when we give contrast, we see that the rest of the globe enhances strongly, and this on MRI, a diagnosis of orbital melanoma was made, which was confirmed on histopathology at the L.V. Prasad Institute in Hyderabad. We can have neoplasms at very unusual locations at times, and this was a patient with swelling on the dorsum of the hand, which was again enhancing very strongly, and in histopath it was a squamous cell carcinoma. In case of imaging of the liver, MR is getting better and better because there are so many new sequences in the plain imaging as well as in the contrast imaging. If you see this T2 image, you can see that there is possibly a lesion, but when you do a diffusion, you are convinced that there is a lesion and you can completely define it very well. And you have these in-phase as well as opposed phase images to further characterize a lesion. And now in contrast MRI, we have an arterial phase, we have a venous phase, we have a delayed phase. And the big advantage with MR is that the contrast stays in the liver and the area of interest for a fairly long time, and you get good amount of time to evaluate that. And at the same time, you have contrast enhancement of all structures in the abdomen, so you can evaluate all structures in the abdomen at a given time. This is an image which shows an abnormality in the pancreas, and at the same time we do a MRCP, which is a map of the biliary tree of the liver, and we can see that there is an abrupt cutoff of the common bile duct, which we can call shouldering, and that indeed says that this is a malignant lesion. In case of imaging of the prostate, the accuracy of MRI is extremely high because the resolution is extremely high. So even such a small area which is shown by the arrow can be picked up, and the T2 sequence which is demonstrated here is the one which we look for diagnosing CA prostate. So on the T2 sequence, the malignancy looks as a dark signal as is shown here. And we can do a spectroscopy in the prostate as well, and which is also extremely accurate, where we get two peaks, the citrate which is a normal metabolite, and choline again which is metabolite of malignancy. So this is an example of a normal prostate, and this is an example of an abnormal prostate or a CA prostate where the choline level is extremely high. And mind you, this is a completely plain technique. Without contrast, you can have this accurate diagnosis. This was a female patient who was, where the gynecologist suspected that there is a lesion in the vagina, but a confirmation was required. So this contrast MRI was done. And the arrow points to a lesion which you can see is actually dark on the contrast. So what does that imply? Well, this is a lesion which has enhanced very strongly, very early, and the contrast has washed out from the lesion also very fast. So therefore, although the uterus and cervix are bright with post-contrast, the lesion is still dark. And the beauty of MR is that you can see it in different planes, and this is how it was seen in the sagittal, and vaginal CA was diagnosed on histopath. A small endometrial lesion, so however small a lesion is, you need to characterize. And for this patient, a dynamic contrast was done, which is administration of contrast at the same time as we are doing the MRI. And we simultaneously plot such a graph to understand how quickly a lesion is enhancing. So the red line on the graph shows that the lesion is enhancing very fast, and the contrast is washing out very fast. Such a lesion is very highly likely to be malignant. And this is an extremely accurate technique. Another patient where there is an endometrial lesion which is seen to invade the myometrium on the T2 sagittal. But when we do a contrast MRI, we can very, very clearly see the endometrial lesion as well as the myometrial invasion. And this is very much of high utility in staging the disease.